Hello, my name is William Dillon, and I am speaking on behalf of the Len Center at the University of Pittsburgh. In conjunction with the University of Pittsburgh and Children's Hospital of Pittsburgh, Len is an interdisciplinary training program that educates future leaders in the field of disabilities with the hopes of improving the lives of individuals with disabilities and their families. I am currently a first-year Len trainee and a second-year graduate student studying audiology at the University of Pittsburgh. In the following presentation, I am going to discuss certain aspects one should consider when communicating with individuals with hearing loss. This collaboration was sponsored by UCP Class and the LEN program of Pittsburgh. Funding for LEN is provided by the Maternal Health Bureau. To learn more about the LEN program, please follow the hyperlink listed here. It is estimated that 31.5 million people report a hearing difficulty, which is around 10% of the U.S. population. Hearing loss affects those who are young and old. Therefore, one should be aware of hearing loss across the age ranges. With that being said, it is likely that you know and communicate with someone who has a hearing loss. The severity and types of hearing loss will vary amongst individuals. There are three main types of hearing loss. Conductive hearing loss is caused by damage, disease, or malformation of the outer or middle ear. In this type of hearing loss, sound is prevented from reaching the inner ear and can sound muffled or weak. An example of a conductive hearing loss would be a hearing impairment caused by an ear infection. Sensorineural hearing loss is caused by damage, disease, or malformation of the inner ear or the hair cells of the inner ear. Sound can be perceived as weak or distorted. This type of hearing loss is permanent and more prevalent in older individuals due to the degeneration of hair cells in the inner ear. An example of sensorineural hearing loss is noise-induced hearing loss caused from excessive exposure to loud sounds. Mixed hearing loss is a combination of both of those types. The severity of hearing loss is described as mild, moderate, severe, and profound. Depending on the severity of one's hearing loss, one will struggle in a variety of listening situations. Typically, those with hearing loss complain of difficulties understanding speech, difficulties hearing a noise, and difficulties hearing in highly reverberant rooms, like a large auditorium. Luckily, those with a hearing impairment can often improve their listening difficulties with a form of amplification or assistive listening device. I am just going to briefly explain some of the types of amplification. I thought it would be useful for the viewers of the presentation to see specific types of amplification to become more familiar with each type. The following is a list of styles of hearing aids, and displayed to the right is a picture for each. The style of one's hearing aid does not necessarily determine the severity of one's hearing loss. However, it may influence the selection of a particular style. Lifestyle and cosmetic desires will often determine which style is most suitable for an individual. A BTE, or behind-the-ear hearing aid, is a type that is worn behind the individual's ear. An ITE, or in-the-ear hearing aid, is worn in the ear, fills the canal and the entire bowl of the ear. A CIC, or completely in the canal hearing aid, is deeply inserted into the individual's canal and one of the most discreet hearing aid options. An ITC, or in the canal hearing aid, fits in the canal, but not as deeply as completely in the canal. A BAHA is for individuals with a conductive or mixed hearing loss, a type that would affect the middle or outer ear. This device is surgically implanted and transmits sounds through direct conduction through bone vibrations in the inner ear. Bone vibrations to the inner ear, Cochlear implants are surgically implanted medical option for those with a profound hearing loss in both ears. A cochlear implant directly stimulates the auditory nerves and bypasses the hair cells of the inner ear. A cochlear implant converts sound into coded electrical impulses that can be perceived by the listener. A personal sound amplifier is a sound amplifier that has a separate tone and volume control to produce clearer sounds. A personal frequency modulation system is a system that consists of a transmitter microphone used by the speaker and a receiver and headphones or neck loop that the user wears. Typically, an FM system is compatible with the user's hearing aid. In that case, the sound is broadcast directly to the listener's hearing aid. An FM system works well in larger group settings, especially when noise is present. There are several modes of communication that one with hearing loss may use, and the listener should be aware of all of them. Sign language. This is mainly used for those who have a profound hearing impairment. Although one may not be able to understand sign language, one should accommodate the needs of a sign language interpreter. When communicating with an individual through a sign language interpreter, it is important to focus your attention on the hearing impaired individual. Even though the interpreter is the one relaying the message, you should still face the one you are communicating with for the duration of the conversation. Those with a hearing impairment often depend on visual cues, such as lip reading, to communicate. Therefore, it is important not to block your mouth from the line of vision of the individual with hearing loss. Also, one should speak slowly and clearly to allow for the easiest interpretation. The final and most obvious communication modality is speech. The speech of an individual with hearing loss may be altered depending on the severity of one's loss. One should be aware of any speech impairments an individual with hearing loss may possibly have and learn to adapt to the given situation. In addition, one should consider one's own speech when communicating with a person with a hearing impairment. One should speak slowly and clearly. When communicating with individuals who are hearing impaired, there are few communication strategies that may assist in a more successful exchange of information. Not all of these strategies may be useful for a particular individual, as hearing loss widely varies in severity. Face the individual directly. Therefore, individuals can get visual cues, such as lip reading. Your speech will be more difficult to understand if you are eating, chewing, putting your hands at your face. Therefore, it is best to avoid doing so. Have the person's attention. Make sure the listener is aware that you are speaking to him or her. You can say the listener's name before speaking to them, or you can acquaint the listener with the topic of conversation. Speak slowly and clearly for the best listening outcome. If possible, eliminate any background noise. Most people with a hearing impairment have greater difficulty understanding speech when there is a background noise. Position yourself accordingly. If the individual with a hearing loss hears better in one ear than the other, try to make a point of remembering which ear is better to avoid speaking in their poorer ear. Avoid talking from another room. Speaking in another room eliminates visual cues and can make sound muffled or distorted. This listening situation may even be more difficult for individuals. This listening situation can even be difficult for individuals without a hearing loss. Take turns speaking to avoid any miscommunication and to ensure that the message is directed appropriately. If necessary, accommodate a sign language interpreter. As I said earlier, make sure to speak to the hearing impaired individual and not the interpreter. Sometimes people tend to ignore the person you are actually speaking to. One should make use of the many technologies to communicate with others and utilize them effectively. For instance, one should include captioning, email, and text messaging to provide textual support when needed. Also, one should be willing to wear a microphone for individuals using an assistive listening device. Give extra time. One should be willing to allow the individual with hearing loss extra time to respond to questions, as it may take them a little extra time to figure out exactly what you just said. To ensure that the message was delivered to the individual, one should clarify often. Also, to avoid confusion, one should keep sentences short and reword if necessary. Finally, one should use hand gestures and facial expressions when speaking. Many of those with severe hearing losses depend on visual cues to perceive a message more clearly. This concludes my presentation. I hope you enjoyed and learned something. If you have any questions about any of the information discussed in this presentation, please email me with the address displayed here. I would like to thank UCP class for giving me the opportunity to speak. Have a great day.